St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walisugulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us right here on Capuchin TV to our health talk show that we bring it to you live every Tuesday from 9 a.m. My name is Maureen Kimani, and I hope that you have been enjoying your Easter season. I know the celebration are still on, but some of you have already gone back to your work, and that's why we bring you this health talk show that is brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital in Langata. Just to make sure that you have the right information, we educate you and we create awareness just to make sure you are living healthy and you are taking care of your bodies, and that's why we have this health talk show. And today we shall be talking about cervical cancer. Well, I'm sure you're asking yourself, why are we talking about cervical cancer? Because January month is set aside for creating awareness for this cervical cancer. It is because it is the second leading cancer. After that is breast cancer, and it's a very good way to make sure that women are informed out there. I know all of us have sisters, cousins, and our mothers around with us. And welcome to this health talk. And in our studio we have guests from St. Mary's Mission Hospital, of which she will be introducing herself, telling us what she does there. Welcome and a very good morning to you. Hi, madam.
Hi,
how are you doing?
I'm fine, thank
How
you.
is your morning and how was your Easter season?
I really celebrated Easter in styles. At this moment, it was nice. Despite the challenges we are having in our country,
Yes.
we were able to celebrate it, and we thank God. This morning we are alive and ready to start the day.
Well, interesting. Thank you so much for making time. And I'm sure our viewers are asking themselves, who do we have in the studio? You can tell them who you are, your name, and what you do in St. Mary's Mission Hospital.
Okay, once again, I'm Regina Ngure. I work as a nurse in St. Mary's Mission Hospital. Particularly, I do work in the cancer screening department, that is the cervical cancer screening especially, but we also deal with other cancers, like especially the cancer of the breast. and the reproductive system, that is. Yeah.
Well, thank you for making time, Regina, to our studio and to help our viewer to learn a lot, and especially the ones that you are talking about, that is the women who are very affected to these cervical cancer, of which some call it cervical cancer. Yes. Now you can tell us, what is cervical cancer?
Just in summary, cervical cancer is a type of a cancer that affects the tissues of the cervix. It normally affects the cells of the cervix. And to elaborate on the cervix, it is the outer lower opening of the uterus. That is where the baby pass, especially when you are giving birth. That is the opening where the baby comes up from. Yeah.
Well, and as usual, it's the women that are affected with this cervical cancer. What's the age preference?
With the age prevalence, we can say majority of people who tends to get cancer are ages from 35 to 49. But you can as well get people from 21 and above, especially if they have engaged themselves in sexual activity in early stages. Also, from 50 years, we can be able to get those people who are not diagnosed earlier. So, generally, all stages, all ages, we can have cancer. Yeah.
Okay, as you mentioned that we have the age and the stages, what are some of the stages of this cervical cancer?
Okay. To elaborate on staging, whatever a doctor does in order to be able to treat the patient is to stage. It is going to give him a very nice view how far his cancer has metastasized, how is it still in the cervix, or has it gone to the other parts of the body. And generally there are 4 stages of cancer. We have the stage 0, whereby in this type of stage, the cancer is just in situ. There is precancerous cells, and if they are not well treated, they are able to turn to cancer. That is in stage 0. We come to stage 1, whereby the cancer cells, they metastasize, they affect the cervix, the deep tissue of the cervix. They have not metastasized to the other part of the body. They are just localized in the cervix. And generally we can say when somebody is diagnosed when she is in stage 1, there is a very high chance of dealing with this type of cancer. We go to stage 2. Stage 2, the cancer now starts going to the other part of the uterus. The cervix and the uterus are affected by the cells, the abnormal cells. That is the stage 2 cancer, but they have not affected the lymph nodes. We go to stage 3. In stage 3, the cancer now starts going to the other parts of the body, especially the walls of the pelvis. It can also affect the bladder and the ureters. You can see a mother coming to the clinic saying that she has a problem when urinating. And it might be because there is a blockage of the ureters. The passage of the urine, the patient is unable to pass the urine because there is metastasis of the cells to the bladder, to the pelvis, and its walls. Lastly, the 4th stage of cancer, this is the one now it is coming to be difficult to deal with because it is going to go to the other organs like the lungs, the bones, and even the liver. By this, the cancer is becoming complicated, and dealing with it might be very hard, unless it is. It can also always be treated by surgery or other type of treatment like radiotherapy, chemotherapy, and also TAH the uterus can be removed. Yeah.
Wow, so there are 4 stages of this cervical cancer.
Yes.
Okay, and we always know that every disease that is diagnosed, it has some of the causes. What are some of the causes of this cervical cancer?
That is a very nice question.
Thank you.
Because some of the things which brings about cancer, a person can be able to deal with them in early stages, especially when a lady or a young person engage herself in sexual activities. You see a girl engaging herself in sexual activity from 15 years or below. This is a very big risk factor because normally in every woman, HPV virus it might be there. Majority of people will normally get the HPV virus, and in case the person engaged herself in early stages, that means this virus is going to live in herself in longer time, making it a chance of turning to be cancer. Secondly, you can get cervical cancer when you engage yourself with multiple sexual partners. This is because in case you have several sexual partners, you might have one who is having the virus carrying by himself. Unfortunately, the men are not affected by the HPV virus. They only pass to the ladies. And therefore, if you get a HPV virus from your sexual partner, you are going to have a risk of having cervical cancer. Thirdly, you can also get cervical cancer by taking prolonged taking of pills. This is because, especially if a woman takes pills, that is dihydroxysteroid, you can be able to get the drug, the hormone can be able to pass through the placenta and affect the baby who is in the womb. And this is when the delivery is done, the birth of this child, she can be able later to have a HPV virus in herself, which she acquired from her mother. Yeah.
So those are some of the causes that causes these cervical cancer. And I think you forgot to mention on the sexual partners, when you say having multiple partners, you can have a partner who has multiple partners also. I think that one might be also a cause for these cervical cancer.
Yeah.
And after now we talk about the causes. What are some of the signs and symptoms of these cervical cancer? Because you mentioned about the stages. We have the early stage, we have up to stage 4. What are some of the signs and symptoms?
Generally, to start, I can say it is very hard for you to diagnose cancer in early stages, and especially if the woman is not ready to come for screening. It is too unfortunate that cancer doesn't present with pain, whereby majority of us will go to the hospital when we have pain. Some of the people will come when they have the PV discharge, vaginal discharge, maybe thinking that they have an infection which they have gotten from their sexual partners, from dads, or those other things. So one of the symptoms, the signs of having cancer of the cervix, it might be PV breeding, especially breeding after coitus, that is after sexual activity. You can start having bleeding. But this can be experienced in case the lesions, the cervix itself has some lesions which are making the lady to bleed whenever she has a sexual intercourse. Also, you can have bleeding between menses. After you get your menses, when you're almost starting to have your menses, your monthly periods, you can get some bleeding from nowhere. Maybe it is because your cervix has been affected, and in case it is triggered a bit, there is bleeding which is coming from the cervix. You can also have lower abdominal pains, which majority of people will come telling me, I'm having a pain which is coming lower on my abdomen, and sometimes it is going back to my back. So that is a sign. And in most cases, we do advise such patients to go for screening. And also, you can also have postmenopausal. There are those people like age 50 and above who have ceased getting their menses period, and they come to the hospital having prolonged periods, and they are seeing blood. So that is one indication she might be having cancer of the cervix. There is something which is abnormal happening in her body. Not always that it is cancer, but that is one of the symptoms which we normally take great care when a patient comes to us and tells us she has bleeding after menses. Yeah.
What about prolonged menses, even after 1 week or 7 days? Can that be some of the sign and symptom of having this cervical cancer?
Sure. Yeah. In case you prolong the menses, like especially if you had regular menses, and later on you start having the bleeding, the prolonged bleeding, like you are getting your menses 7 days, and now you are getting it even over a month. This is a very big indication that you might be having a problem. And in this case, we don't normally mention it is cancer. We normally say there might be the cells, the abnormal cells, which are forming in your cervix. And therefore, we normally take care and precaution to continue with the further investigations. Yeah.
Okay, and that's very quite interesting, something to mention about the multiple and partners. I know there's a way you can help to lower these chances of cervical cancer. As you mentioned, the multiple partners, it can be controlled. I feel for the couples and even for the people who are married, they can be very faithful to their partners. You don't have to, go outside and out of the wedlock. That is what we call it. What are some of the chances that you can do to lower this cervical cancer?
That is a very good question, Maureen. Because in case people take care of themselves, and especially going for medical checkup, I think it can help a lot. First, the best thing to prevent yourself from getting cervical cancer is getting a vaccine, the HPV vaccine, the human papilloma vaccine, which is recommended even worldwide. This one, it normally helps to stop the cancer from spreading and also getting the cancer itself. Because majority of us, as I had said, we normally have the HPV. And in case we give the HPV vaccine, at least in a way it is going to prevent us from getting to that stage of getting cancer. We can also visit our hospitals for screening. There are various types of screenings. I know majority of people, they do fear the procedure itself because it is so traumatizing.
Yeah.
But keeping in your mind that it is going to help you in future. And that is the only way you are going to prevent from yourself becoming infected or getting the cancer, which when it comes to the last stages, it is so difficult to heal and also costly. There are pap smears which can be done to you. This is just a type of screening whereby we take a smear from your cervix and we do analyze it and we get whether there are those abnormal cells which are growing. And in case you get there is those abnormal cells which are starting to form in your cervix, it is we are able to treat it in good time. We have also fear viris. The fear viris, we also do it in the same way. We do put a speculum and we normally see your cervix and we are able to analyze. There is a dye whereby we put and we normally see whether there are changes of the cervix. And we are able to tell whether you need further treatment or what else can be done to you. You are okay. So when you come early, we do the screening.
I think as you talk about the screening, because we have the cervical cancer screening that we shall handle on our second part. Let us take a very short break, and then later when we come back, you'll tell us what does this screening entails and when can one visit even St. Mary's Mission Hospital to do the screening, right? Okay, thank you so much, Regina Ngure, that is from St. Mary's Mission Hospital. Thank you for the first part of the introduction of what is cervical cancer and what are some of the causes that causes this cervical cancer. We're taking a very short break. We will be right back on our health talk show right here on Capuchin TV. Stay tuned.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity.
A very good morning. Welcome back to our health talk show with me, Maureen Kimani, and in the studio we have Regina Ngure from St. Mary's Mission Hospital, and we have been talking about cervical cancer. And now, as we talk about some of the recommended cancer, before we had gone for the break, that's what we were talking about, the as through on these methods, and welcome back. Before we go to the screening now.
Okay. With the cervical cancer screening methods, there are various type of methods whereby we use to screen for the mothers in order for early diagnosis and prevention of cancer. Firstly, we have the primary, which is the HPV screening. This is recommended for those people who have started they are sexually active, be it from 21 years and above. And whenever you have engaged yourself in sexual activities, you're supposed to be screened. And HPV is one of the recommended method of screening such ages. We also have the pap smear, pap test, as other people call it. This one is also done to those patients who are aged 25 to 49 years, and it is usually done yearly, and in other cases we can also tell you to come after 2 to 3 years, depending with whatever we have from the first screening. In case we have gotten any their precancerous cells which are coming up, we normally tell you to come back after a year. From age 50 and above, we don't normally do the FIAVIRIs, like even in 21 years and below, because there is a problem. We can't be able to detect the cells nicely because the squamous columnar junction is not well formed for those 21 years, and from 50 years and above, the SGJ, the cells are now diminishing, so you can't be able to detect well whether this patient has precancerous cells. The FIAVIRI, which we are talking of, this is another method we usually use, and we do 2 types of screening. There is FIA and there is FIL. So we normally start with the FIL, whereby we paint the cervix with vinegar, the normal vinegar which we use in our body, in our homes, food? In our food. And it is able to detect whether there are stages with the cervix. The FIRI, we normally use Lugos iodine, but you cannot do the Lugos, the FIRI alone. You have to do it co-test with the FIA. So whenever we are doing FIA, we are doing FIRI. It is called FIAVIRI. And this is recommended to those ages 35 to 45 years old. That is what I've already said. We can also do, in case we get there is some cancerous tissues which are detected, we can do colposcopy. But that one will come to mention it when we are doing the management of precancerous tissues. Yeah.
And how often should one be screened for this cervical cancer?
Yeah. Generally, in order for you to be assured that you don't have cancer, it is usually good to do it yearly. But nowadays we are recommending 2 to 3 years for sexually active stages. That is from 35 to 45 years. You are supposed to be checked every 2 to 3 years. Because with the cancer cells, they take long before they appear. And sometimes you can come to me, I screen you, and the results, they become negative. You stay for 5 years, maybe there were those cells which were starting, and later on they appear, and they become cancerous. So it is usually nice for those active, sexually active clients to come to hospital to be screened 2 to 3 years, that is. 50 years and above, because at this time, people are becoming less active, sexually active. We normally do it after every 5 years. But we can also do it if you have any sign. When you come to us and you report an alarming sign, we can do it. despite not having gone for those 5 years. So that is.
What about those ones who are already diagnosed in the early stage? When are they supposed to do this screening? After how long?
Okay. In case you come and you are done the first screening and you are diagnosed to have cancerous cells, we normally advise you to be coming yearly.
Okay.
And also those who are immunosuppressed, like the HIV patients, positive patients, we normally advise them to be coming to hospital for screening every 1 year. Yeah.
Okay, and let's talk about the management precautions of cervical lesions. Maybe you can tell us what is it all about?
Okay. With the management of precancerous cervical lesions, this is a treatment whereby we give for the precancerous cells lesions, and there are various type of treatment we do. One is the cryotherapy. The cryotherapy is whereby there is freezing of the cells, the precancerous cells, and this is normally done in the early stages of cancer, those which are just located in the cervix. Because what normally happens with cryotherapy, it is normally freezing of the cells. So we use a cold thing. A cryoprop has to be cold so that it can freeze the cell to prevent them from metastasizing to the other parts of the body. Unfortunately, sometimes you can kill the normal cells, but afterward they are going to regrow. So after doing the cryotherapy, we normally advise you to come for checkup every yearly, so that we can continue making sure no more cells are going to reoccur. Yeah. The second one is thermoregulation. Like in cryotherapy, whereby we have been using the freezing, with this we use the heat. The heat is the one which is put in the cervix, and with the heat, it kills the abnormal cells, and it is it normally works well if the treatment is given early. When you come early and we diagnose you have the cancer cells, we normally use the thermoregulation in order to kill the abnormal cells. We have LEAP. With the LEAP, it is initials for loop electrosurgical excision. Loop is normally done with an electrical wire. This one is, however, done by the doctor in theater, because the patient has to be sedated, or the patient has to be given local anesthesia, whereby the cervix is going to be pain relief by injecting anesthesia, so that somebody doesn't get feel pain. Yeah. This is also a method whereby it is so effective, and especially when it is done in early stages.
Okay.
Yeah. We have also cold knife colonization. In Kenya, this is rarely done, but in majority, somewhere you can get it. Yeah, you can get it even in Kenya. This is whereby there is excision. You use a scapula or a laser to remove some of the cones, those which are affected by the cells, the abnormal cells, the cervical cancer cells. Yeah.
Okay. Thank you so much, Regina. And we have one question. How do you tell you have cervical cancer, whereas some who go to hospital one is informed on the last stage? How can one tell?
Wow. Surely it is very difficult for you to realize you have cancer unless you come for checkup, or when you have those minor symptoms, those minor signs, like the way we said, low abdominal pains, PV discharges. You know, the problem is with cancer is that it doesn't manifest itself with pain, and sometimes you can stay with the cancer for a very long time before realizing you have a problem. So for you to come to the hospital, maybe even you don't know that you are having cancer, but after doing several investigations, and especially the screening, whereby we do our screening, we can be able to realize there might be something wrong with your cervix, and we are able to tackle it earlier. So this one is going to guide us on what else can we do to this patient. And especially when we realize the patient comes with those signs which seem to be cancer related, we normally advise the patient to do the screening. Yeah.
Okay. And there is another one. If a mother has a cervical cancer, can one get pregnant? And if so, can it spread to the baby?
Yeah, I know majority of people do wonder that people might not get pregnant when they have cancer, but surely you can be able to get cancer, and to some extent it cannot really spread to the baby. Yeah, this is because there is the barrier, the barrier whereby the cancer cell can't be able to go to the baby unless the mother is taking the pills, the DES pills. Those one, because they do pass through the placenta barrier, the baby can be able to get the cancer. Yeah. To answer your question, whether the mother can get pregnant, yeah, you can get pregnant. But the problem is your immunity is very low. So even taking care, handling that pregnancy, it will be hard for you because yourself, you are weak. You need so much management to be taken upon you. And in this case, you normally, sometimes you get a mother having abortion. But there are those people, there are those women who normally carry their pregnancy up to term. So you can be able to get pregnant, yes.
Okay, well, very interesting. And can this cervical cancer spread to other parts of the body?
Sure.
It can?
Yeah, it can. That is the thing I'm doing. I'm saying metastasis. Metastasis is a term used whereby the cancer has spread to the other part of the knee. From the original part where the cancer started, it can be able to spread to any other organ, to the pelvis, to the lungs, to the kidneys, to the liver. It can spread. Yeah.
Okay, well, that's very interesting from you, Regina. Thank you for informing our viewer and for educating them, because it's a very nice thing. I feel women are very sensitive, so they have to take care of their bodies, and also for the men. Yeah, so before we wind up, what do you have to say? Do you have this screening at St. Mary's Mission Hospital? And if so, when can one come to visit the clinic or the hospital to have these services?
In St. Mary's Mission Hospital, which is located in Langata and also in the Metaita, we do have these services, cervical cancer screening, and also we do even breast cancer screening. Our clinics are usually held from Monday to Friday from 8 a.m. to 5 p.m. And what I can tell every woman ama every month, because even them, they should be part of it. It is good to come early so that we can be able to detect and be able to diagnose and treat it early. Because with early diagnosis, there is prevention of the cancer spreading. And so we normally do it daily on Monday to Friday.
Okay.
Yeah.
Oh, thank you so much. And before we wind up, I have one question from Linus. He says, does cervical cancer screening have age limit and are young at risk? I don't know if you can answer that, or we have already tackled. Does cervical cancer screening have age limit and are young at risk?
Yes, I can say yes and no. With cervical cancer screening, there are no risk for screening, because what we normally use, they are those things which they don't have any effect to your body. The age limit for cervical cancer, we said you can screen even at lower age from 21 and below. If the patient or the client has engaged herself in sexual activity.
Sure.
So you can be able to start screening even from 21 years and above. The age limit which nowadays we are not screening so much, it is from 60 and above.
Okay.
That is because this is the age whereby they are not sexually active. And maybe if this patient has been coming for checkup, we have really scrutinized and we have seen that this patient can't be able to really to get the cervical cancer, because with their cancer cells, they take long to be diagnosed, or they take long to realize that you have it in your cell. From 65, I don't think this lady is engaging herself in sexual activity. Yeah.
Okay, all right. Thank you so much. And as we wind up, because I feel we have tackled most of these information that we need to help our people, our viewer, to have them, especially the women. What is your parting shot? What do you have to say or conclude about this general topic of cervical cancer?
Okay, to my viewers and to all women, what I can say is that generally cancer is spreading too much. It is one of the leading cause of death nowadays. Previously, people used to fear HIV and other diseases, but I think with the HIV and other diseases, there is cure. When you come to hospital and be screened with cervical cancer, you are able to get proper treatment, and it can be healed very well, and it can't spread. As long as you come to the clinic early and you are diagnosed, cervical cancer can be treated. Most of the people believe that cancer cannot be treated, but that is a myth. Cancer can be treated. In early stages, cancer can be treated. So what I can caution you is to come to clinic, to hospitals, for screening. Just take care of yourself so that you can be able to live a healthy life. Yeah.
Okay, thank you so much, Regina, for making time to come here in our studio to share to our viewers about this cervical cancer and talking to them about the screening, because it's very important for one to know their health, you know. When it comes to dental, to anything, any part of the body is very important for one to be taking care of it. And with that, I think we have come to the end of our health talk show right here on Capuchin TV. Thank you for tuning in and for following, and for those who have been sending questions, asking 1, 2, 3, and we appreciate you so much. And as we extend our gratitude to St. Mary's Mission Hospital, the whole entire team, and not forgetting Lydia Chanya, who has been able to organize these, that every Tuesday we have someone from St. Mary's Mission Hospital to come in to share to our viewer about our health. Yeah, thank you so much also to our Capuchin TV crew. We have Alan Andiva, Eric Otieno, and lastly but not least, we have Michael Kibandi Gatimo, who is our transmission manager. Thank you so much, and wishing you a blessed week ahead. May God bless you. See you next time. My name is Maureen Kimani.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 02 07 851 300. In Elementaita, call us on 07 17 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.